Excellent. Thanks everybody. Jim, thank you very much. Heartland, thank you. Nikki, where's Nikki? Nikki, thank you. And I really appreciate you giving me this opportunity to go over my book a little bit with you, and maybe we can have a great conversation about healthcare here. You know, again, as Jim said, that my background is really mostly an IT background. So I'm not a doctor, although my dad was a doctor. My son is in medical school. I have a daughter who's in pre-med at Loyola. So I guess it skips a generation, but I'm very interested in the healthcare field. I'm very passionate about it, and I'd like to give you just a little bit of a story about that passion. So as Jim said, that you know, in 2000, we started this company called LDT Systems, and ultimately we ended up creating a system to match organ donors and organ recipients, and using the internet. Now that had never been done before. A lot of people say, well, gee, the internet's been out there, but the way the whole structure of that industry is set up, they were based on paper and telephones to call medical information from the donor's bedside to the transplant centers, typically 35 centers per donor to try to place usually 3 or 4 organs. A very long process. We helped to automate that process with the internet and cut that time from 12 hours down to 2 hours per donor case. So by being able to do that, we were able to save a lot of time, which helped them place more organs. So we actually increased transplant. We did about 6,500 organs in 5 years. We increased transplant by 500 organs, saving 500 lives that would not have had an organ had we not had the system in place. So when we first launched the system in 2002, we wanted to have a way to sort of remember this. We wanted a commemorative object to remember everybody's hard work and this sort of groundbreaking work that we had done. So one of us is affiliated with, as brothers, was a major league trainer for years, so he came up with the idea to have a baseball. So we would have a baseball, we'd all sign our names on it, the development team, and then we would, for the very first organ that was placed, we wanted to have the recipient sign their name in what they call the sweet spot of the baseball, which is where all the pros sign it. As it turns out, the very first donor case that we had was the recipient, the donor was an 8-month-old baby who donated their heart and liver, and the recipient was, the heart recipient was a 4-month-old baby. So the transplant surgeon's name is Dr. Leonard Bailey. He's one of the top cardiothoracic pediatric surgeons in the world, out at Loma Linda University Hospital in California. We were actually there and got to see the baby, but he came up with the idea. He said, well, why don't we just get a thumbprint of the first recipient? And we actually got to see the baby. He's about that long, had this little scar on his chest, you know, got a new heart. It was pretty amazing. So what I brought today with me was the baseball that, and I put it in, I can't touch it because it'll smudge all the signatures, but you might be able to see that little blue dot on there. That's the thumbprint of the baby who received the first organ through our computer system. So that's why I'm passionate about healthcare, and that's why I wrote this book, and that's why I'm so angry about Obamacare, which you'll find out here in just a moment, how angry I am. So, so that's really why I want to fix healthcare, and that's why I've taken a information technology, information systems approach to how do we fix healthcare, not a political approach, although I mentioned politics in here, but I think through logically every step we need to do to get healthcare to what I call an open market situation. So let me just kind of launch into this. So this is Obamacare. And some of you may have seen this horrible chart. It was produced by the Republicans on the Hill. And quite frankly, this is a disaster. There's so many bad elements about this bill. It will take me a long time to really describe all of the elements. I've read most of it. I'm not a lawyer, but it's vaguely written. And a lot of people don't know this, but we have about 160,000 pages of regulations in the Federal Registry right now. Obamacare has the potential, if they write the regulations like they've started doing, there's so many pages that they can write. They can write close to 300,000. They can almost double the number of pages of regulation that we have in the entire Federal Registry. Think about that. Think about what kind of an impact that's going to be not only to healthcare, but also to our whole society. I mean, it's going to crater our healthcare system. It absolutely will. I will guarantee it right now. It'll collapse the system. And I predict that collapse under Obamacare, if we do not repeal it, we will collapse what I call the healthcare financial system between 2014 and 2016. And that's based on looking at the financial pressures that it's putting on businesses and businesses shifting that risk over to their employees. It just so happens that on September 27th in the Wall Street Journal, they wrote that both Sears and Darden Industries have said that they're going to start giving their full-time employees a monthly stipend to buy their own health care, their own health insurance, so that they can offload that risk to their employees. Well, there's a massive amount of risk right now that the businesses are absorbing, and when that goes to their employees, to the consumers very quickly won't be able to handle that load. And it's based on that. It's also based on many other factors, but it's it's going to, obviously we've heard about it increasing taxes, and there's so many burdens that it's putting out there. The other interesting thing is, it'll certainly bring down, with all the regulations and everything, it'll bring down healthcare, and will bring down the rest of our society with it, of our economy. However, assuming and hoping that, at least I do, that Mitt Romney and Paul Ryan are elected on November the 6th, even if as he says, the very first day he gets in there, he's going to put waivers out to 50 states, which will be great. It'll essentially neuter the bill, but it'll still leave companies in a state of flux because they won't know what the next shoe to drop is going to be. So hiring is being reduced. We're starting to see stock market go down. I believe that trend's going to continue. I think earnings numbers are coming out and they're not looking good. So, I mean, there's a tremendous amount of negative pressure this bill is putting on our economy. I still believe that if it's not, even if it's repealed in 2012, healthcare is still going to collapse between 2015 and 2018 if we don't have major reforms. I base this on an analysis that I did that when healthcare reaches 20% of our gross domestic product, I believe that's the tipping point. I believe that's the point when health insurance companies, the whole health insurance market will collapse. I believe that's going to happen. So we need to start making the changes now to avert this collapse. And that's really what the book is about, and that's what the rest of this discussion is about. So we've got to save the system before collapse. We have to stop the healthcare inflation spiral. A lot of people I ask, what do you think are the reasons why healthcare costs go up? What's your thought? Why costs keep going up all the time?
Well, comparing to when I was a young man or a small child and now, there have been enormously productive research bringing wonderful, wonderful developments.
Mm-hmm.
And some of those are very, very costly to do.
Mm-hmm.
What did somebody say? Life is a sexually transmitted disease with 100% mortality.
Right.
Which is still true even
Right.
after all those developments, but everybody
Right.
wants to live forever, and they don't associate, in the United States, people think healthcare is free, quote
Right.
unquote.
Right.
So there's none of the usual evaluation you do with everything else.
Sure. And other thoughts I've heard are it's the greedy doctors. We've all heard this, right? It's the greedy health insurance companies. It's research. Those are all subjective elements of why the costs are going up. They're elements, but they're not the core reason. The core reason is because of price control. That's the reason. It has same thing with Jimmy Carter in the 1970s with gas. It's exactly the same thing with healthcare. That's why the prices are going up. So that will stop. If we can control that, we could stop the inflation spiral. And we've also obviously got to reduce healthcare costs significantly. Those costs do not need to be in the system. They are excess costs. There are excess people, excess processes, excess procedures that do not need to be there in order to maintain the same quality of healthcare that we have. Okay, there's excess. My wife works at Advocate Health Group here in Illinois. It's 22,000 people. And I mean, they have so many people studying ways to save money, it's ridiculous. And all of those people are all making six figures, and every one of them has no clue as to how to get the costs down. Neither do health insurance companies. So there's so many people working on it, but but they're frustrated because the costs keep going up all the time. Sorry about that. So we've got to get the last part there. I don't know if this will go backwards. The last. Okay, and then the last one is we've got to get government. Excuse me. We've got to get government out of the business of medicine. Right now, the government can help finance the cost of medicine, but they should not be in the business of medicine, and I'll explain that here in just a bit. So we got to start now. We don't have a lot of time. So how exactly are we going to do this? First, we've got to identify across the board major reforms. Some of the reforms, even that Paul Ryan has proposed, are not enough. We also have to create a large private sector, what I call a super group, to make that happen, a group of groups, a very large single place where the private sector can put its weight, its muscle, its finances behind open market solutions. And I call that the initiative. For longer term, it's the Saving Private Healthcare Initiative, but I've shortened it to the initiative. And the initiative really is both the plan and the group that brings common sense open market reforms to all of private and public sector U.S. healthcare. So who's in the initiative? Really anybody interested in saving our private healthcare system. Notice I use that word private a lot, mainly because we have to oppose the other side of public healthcare, and that's really what this fight's all about. It's maintaining our private healthcare system. And anybody who opposes government intervention, again, or takeover of healthcare. Now, who is it? Thousands of consumers, doctors, and healthcare leaders. And I've got in the book essentially a launch committee that I'm starting to form right now that I'm hoping to have people like Art Laffer, at least from an economic perspective, healthcare leaders, doctors, consumers, business leaders, and so forth. The key is the doctor-patient relationship has to lead the discussion. It's got to be the focal point. Physician and healthcare groups need to be a part of this, but not the AMA. A lot of people know that the AMA supported Obamacare, and they made a big mistake. There's still a lot of doctors there that believe Obamacare is bad. Doesn't matter. The administration of the AMA here in wonderful Chicago decided to support Obamacare. They never should have done it. It's bad, in so many ways bad for patients and for doctors. They shouldn't have done it. And purposefully, we're not going to include them in our initiative. Consumers and senior groups, not the AARP. AARP has become essentially an insurance company for senior citizens, but it's also full of a bunch of people who believe that the government can do health care better than the private sector. And they've completely misled the seniors, their own membership, who vehemently has opposed it, and they still supported it. So we will not include the AARP in our group. Some of the groups we're including are Docs for Patient Care. Another one is called the Association of American Physicians and Surgeons. And so what is the job of the initiative? It's to save private health care. This is not to give anybody a lifelong job, especially me. This isn't to make a whole nother sector of our healthcare system and enrich people. It's to do one thing, and it's to save private health care. So first, what we need to do is start with a general plan that I have in my book, which I'll go into a little bit of detail here on. Second, we need to create a detailed plan for all sectors of the U.S. healthcare industry. So the plan that's in the book, it's 260 pages. By the way, it's on Amazon, and it'll be coming out in hard copy close to Christmas. So what we're doing is we need to take the plan in the book. I have 10 major reforms in there. And then we need to give it to the initiative and blow it out into an entire plan for the entire industry. I am not a smart enough guy to put together the whole plan for the whole industry, but I can get it started, and that's what I hope that I'm doing here with the book. We also need to author federal reform legislation. We can't do it without the government. There's some things we can do, but especially with Obamacare, we need to really have a forward-thinking way of how do we approach Congress and the Senate, and I have some detail about that as well. We need to work with conviction to pass federal legislation, and we also need to encourage state reform legislation. There's over 2,200 state mandates on health insurance companies right now across the country, saying that, we're talking about acupuncture and, these other things. I mean, it covers so many things. It's one reason why insurance is so expensive. And then we need to implement the reforms. And once we're done implementing the reforms, we shut down the initiative. Again, this is not to make anybody rich, and it's not to create another bureaucracy. It's to fix it and get on with life. So what's the calendar? In 2013, I will be forming and launching the initiative. So I'm starting to put the launch committee together now, and I'm trying to reach out to some of the senators and congressmen for some help there. And then 2014 will actually begin the reform process for all of healthcare in the United States. And then by 2022, we'll complete the reforms. And I've got actually a little bit more detailed schedule in the book of all the different steps and the timing of them, but I think it's about in that range. So what are the cost savings of the initiative? I believe that if we implement all of the reforms that I've put in here, we will save $2 trillion per year in a $3 trillion industry. So we will save 2/3 of the cost, 67% per year by 2022. How did I come up with that number? This is my projection. I'm going to have to go over here. So, anyways, this red line here is the current slope that we're on in terms of our national health care expenditure, and that includes private and public health care. And again, between 2015 here and 2018, I believe collapse is imminent. So we really need to start bending that cost curve down in that time frame. And you know, I think we can do it, but we have to make some pretty bold moves, and we need to get this group moving. This is the expenditure projection that I believe will happen under these reforms that I'm proposing. And if you look at this green line down here, that is the actual projection if you took healthcare costs from 1960, just with typical average annual inflation. That's what this green line is. So healthcare industry, without government intervention, I believe is on this path, and I believe we can get to that path by 2022. That's my projection. And that's about $2 trillion from these two lines. In today's dollars, by the way. So what are the sectors? What parts of healthcare are we going to address? Providers, doctors, hospitals, clinics. The payers, obviously, the health insurance companies. Consumers, seniors, veterans, those in need. Medicare program on a federal level, and Medicaid program, both federal and state, will be addressed. And by the way, they all have to be addressed. You can't really do them piecemeal if you're going to fix the problem. I also believe that this is the only capable plan that can oppose Obamacare. So assuming Romney and Ryan get elected, they're going to approach Congress to say we need to get rid of Obamacare, we need to vote for that. Well, senators and Congress folks are not going to be voting for it unless they have an alternative. Because, and right now, if you ask anybody on the Hill, what are the plans? Well, we're going to fix Medicare, we're going to fix this, we're going to fix this. It's all piecemeal. There's no cohesive plan. This is a cohesive plan. I know John Goodman was here some time ago. He's got a plan as well. I don't have a comparison to his, but I'm sure, you know, both of ours are probably somewhat in the neighborhood. But we've got to have a capable plan to oppose Obamacare so they can vote for something. I anticipate support certainly by all Republicans and some Democrats on the Hill. And the difference is, instead of coming up with, I was thinking as I wrote the book, gee, I'm coming up with all these great ideas, how do we get them through Congress? You know, and even John Goodman worked for, what, 10, 20 years and ended up getting one of his small elements of his whole plan through called health savings accounts. And he worked for many years trying to get this done. We don't have that much time. The only way this can happen is if the initiative controls the sausage making. We do not give them the bill. We do the bill. We write it, we manage it, we update it. We do not give them the text, okay? And we go get their votes one at a time. We will make changes that they request as long as they're changes that will help save health care. If they're a bridge to nowhere, we're not going to put it in the bill. And then those that do not support this or that do not support these bills, we will use the power and the force of the initiative to do everything we can to make sure that that politician never wins another political election. So we're not playing games here. We've got to be tough, and we've got to go after these guys and stop screwing around. We don't want them, you know, saying, well, look, I'll vote for this if you vote for that. We're not going to do that game anymore. We're doing one thing, and we're saving health care. And either they support saving health care or they oppose it. And it's that clear. So we'll control all the changes. We'll deliver the bills to Capitol Hill in final form, and they'll be passed without amendment and signed into law. And that's the only way this can actually work. So let's go through all the different changes that I'm proposing here. First, we've got to fix health insurance. In today's closed market, it's employer-based. I mean, everybody here has employer-based health insurance, where others control whose insurance it is, and also to a degree the health decisions that you make. In the tomorrow's open market, it's consumer purchased. You control your insurance and your health decisions, and again, as I said, if you take a look at Sears and Darden restaurants, they are both doing exactly that. They've announced they're doing that, and I believe it'll be a huge number of companies. In the next 2 years, I believe most companies will switch to this model. Okay, so what I've got in the book that I'm proposing is already starting to happen. So we have to fix Medicare. Today's closed market, the government controls Medicare Parts A, B, C, D, and Medicare Advantage. In tomorrow's open market, it's consumer-controlled, what I call Medicare Private, where a monthly benefit support is sent to seniors so they can keep their own private policies. Paul Ryan has a similar proposal, but his is for them to go through state exchanges to buy their insurance. State exchange equals government control to some degree. Mine is completely private market. You buy your health insurance from the private market with the monthly benefit support. Now, fixing Medicare Part 2, government decides how much to pay medical providers, which happens today through what they call reimbursements and RVUs, which is the price fixing and price control that is actually causing the inflation. In the open market, the consumer decides how much to pay medical providers by getting to choose more affordable providers. So the idea is you shop for your own doctor every time you have a medical need. I'll get into that here in a minute. But by you doing that, that means that those doctors have to come up with their own pricing and sharpen their own pencil to make sure that they're delivering value to you. And once you do this, those changes that I've mentioned, one other thing we're setting up is called a medical escrow account. Medical escrow account is very similar to a health savings account, but it's an escrow account, so you cannot take the money and go buy flat screens at Walmart. So it is a concept where your working age family, your employer, again, as Sears and a number of companies are doing, puts monthly amount benefit that's non-taxed into your medical escrow account at your bank, okay? You, at your option, if you want to get a better health insurance policy, might cost a little bit more than your company's throwing in, you can add a few dollars a month to it as well. And that pays for your family's health insurance each month, or if you opt, it can go directly to medical providers, both domestically and internationally. So if you want to go overseas and have a surgery, you can take the money out of your medical escrow account. Once you turn 65, retirement age, folks, this will look pretty familiar. Medicare Private puts a monthly health care benefit amount, again, as Paul Ryan and I are proposing, but I'm adding that it should go into your medical escrow account, the exact same bank account, okay? And then you, when you're retired, if you want a better plan, can opt to add tax-deductible dollars to that, which means that you do not have to change your health insurance policy the rest of your life. So changing jobs, turning 65, you stay on the same policy. Doesn't matter. That is an extension of what they're proposing for Plan of Prosperity, which is Paul Ryan's plan. So you get to keep your plan the rest of your life, and because of this, it virtually eliminates the condition, the pre-existing condition issue that we've all heard about. It effectively goes away. Not 100%, but pretty close to it. And there we go. Next, we need to eliminate managed care. So in today's world, contracts between private and public insurance and doctors and hospitals control how much they charge. They get to charge for their goods or for their services. It also takes a lot of their time to manage these very complicated contracts and so forth. Tomorrow's open market, there are no more care contracts or managed care contracts with any doctors and hospitals. There's no utilization and no paperwork. So one of my proposals is we've got to break the cycle of price increases by getting rid of all of these contracts so that doctors go back to being independent completely. and they could set their own prices, they can do their own thing, and they can compete and do whatever they want from a price perspective. But again, they're not going to charge tons of money because they know there's a doctor across the street who'll charge less, just like we do in every other industry in this country. That's how you drive the cost down. So again, we have to eliminate all medical price controls where the government's currently deciding that, and then now those fee amounts will actually be guided by the consumer. And again, if you don't feel you're getting a value from one doctor, you can easily switch to another doctor. And by the way, this currently works now in cosmetic surgery. It currently works in LASIK surgery. Those are medical procedures. They have anesthetic. They have, they have doctors sewing you up, et cetera, and they all do it without insurance. And guess what? The prices have actually been coming down by quite a bit. So to say that it won't work in healthcare just is simply not true. It's actually proven, and it happens today. We just have to get it to happen to the rest of the procedures that are out there. So next, we need to move all medical records to insurance companies. We've all heard about electronic medical records. Obamacare wants this all into a giant government system, which is going to cost a ridiculous amount of money and take all your very private personal information and give it to the government. I'm proposing we send it over to the insurance companies, because the insurance companies know every medical issue that you've got. They've billed for every single thing. They know more about you than you know about yourself. So having them have formal medical records is really where it should be. Plus, they're really good at computer systems. They've got tons of servers and lots of programmers, and they'd be great at it. So going from your doctor's medical chart in paper electronic form to where the insurance company has it on the secure internet, so you can visit any medical provider in the world that you want. Now, some people will say, I don't want to turn my medical record over to the insurance company. Fine, it's optional. But there might be an extra charge if you choose not to do that. But this way, once it's on the secure internet, now you can shop for every medical need. You don't have to go to the same doctor every time. You can. If you have a doctor that you like, keep going to them. But if you don't have that much money, maybe that doctor you go to costs a lot of money every time you visit them, but there's one 10 miles away that's half the cost. Now you've got an option. You can go anywhere, and your medical chart follows you. And I've got all kinds of detail in the book about it, not from a technical perspective, but just enough to describe how the program works. Next, we need to enable robust medical price and quality competition. So in today's market, the consumer has little choice in who's their medical provider, and the cost and quality are not known prior to appointment. So how many here have gone to the doctor, had an appointment or surgery or whatever? You have no idea what it's going to cost. It could cost thousands, it could cost hundreds. You don't know until you get the bill afterwards from your insurance company that says, this is the supposed price, this is how much we reduced it by, and then this is how much we're going to cover, and then this is how much you're going to owe. You have no idea. You have no clue. In tomorrow's open market, I did it again, the consumer chooses the provider for each medical need, and cost and quality are known prior to making the appointment. So I came up with a concept, a system concept called PSAS, which is Provider Search and Appointment Scheduling System. So you'd go to your insurance company's website for every medical need, obviously except for emergencies, for whenever you're planning an appointment, and you go and you search, just like on Orbitz or Expedia, for the doctor that you, or for the type of procedure you need. And it doesn't need to be very specific. It's just, I might have a cold or a flu, my head hurts, my this, that. Very consumer friendly. And then once you do that, now you could find the doctor you want. All the prices are there. All the quality is on there. So quality ratings and affiliations and so forth are there, even little advertisements. And having all that information, then you could say, okay, I want to go to this doctor. And you select that doctor, and then you actually make an electronic appointment on the internet, so you know how much it's going to cost, how much you're getting reimbursed by your insurance company, how much your out-of-pocket is, when the appointment is, and you know all of this before you go to the doctor's office, to the penny. So, and then we need to remove federal government from Medicaid. So in today's closed market, the federal government controls all the dollars and the decisions of the state Medicaid programs. In tomorrow's open market, the states control the dollars and decisions. Very similar to what Paul Ryan's proposing, is to give block grants from the federal government to each state. That way, the federal government's sort of cut out of the equation of Medicaid. Now, I want to talk about a solution here called the New Jersey solution. It's very, very interesting. It's something that Dr. Alita Eck, who's the head of the Association of American Physicians and Surgeons, told me about that they're doing, and I think it's actually pretty revolutionary. Part of it reforms non-hospital care. So today, Medicaid controls all the dollars and decisions for non-hospital care. So for essentially chronic ambulatory type, where you can still walk kind of care, where you don't need a hospital bed. Tomorrow, doctors will donate 4 hours per week, and they set up non-regulated free clinics for non-hospital care. Okay, well, let me repeat that. Doctors donate 4 hours a week. Again, most of them work 60 hours a week. So they donate 4 hours a week, and they are allowed to set up non-regulated free clinics wherever they think they're needed for just essentially walk-in type non-hospital care, medications, and so forth. And in exchange for that, we have the New Jersey Solution Part 2, which is eliminating defensive medicine. In today's market, medical malpractice lawsuits are filed against doctors personally, which is a mess. We all know that the costs are crazy, and doctors are doing all of these tests just because they don't want to get sued, and if they do get sued, they have to prove that they took every possible precaution, which is why they're doing all these crazy tests, and it's costing us all this crazy money. Tomorrow's open market, the medical malpractice lawsuits must be filed with the state under what's called the Federal Tort Claims Act, which means that no longer do they sue the doctor themselves personally, but they have to go to the state to bring an action against their organization. So what this means is that doctors will no longer have to worry about personally being sued for medical malpractice, which is actually how it is in a lot of other countries around the world. We're, I think, one of the only ones that actually goes against the doctor, the person. Okay. Now, the interesting thing about the New Jersey solution, this is a bill, an actual bill pending before the New Jersey State House right now, and they expect it to be signed by Chris Christie by the end of this year. If they do this, this will revolutionize getting rid of defensive medicine, and it will cut the state's cost, Medicaid cost, in half. So it's significant, significant bill. And I put that in my book as well. So we also want to eliminate medical price controls, where, again, I've mentioned that insurance and government control medical reimbursements. Years ago, in 1965, when they had the Social Security Act and they created Medicare, they also had to figure out how much are we going to pay doctors for these procedures for our senior citizens. So they came up with all these convoluted ways to do it. They started out with what they call usual and customary, and then they went to something now called relative value units, which is a really complicated equation come up with by the geniuses at Harvard. Not a big Harvard fan, by the way, but came up with those geniuses and overcomplicated the heck out of it. There are many thousands of codes that are multiplied by many thousands of other codes to try to figure out how much things are going to be reimbursed for. It's ridiculous, by the way. And it's also related, by the way, these fees are controlling not only Medicare, but also Medicaid, and private insurance goes along with it. So all of this is linked to the RVU calculation. It's the RVU calculation which is the thing that's causing the spiral up in healthcare costs. That's the focal point. We have to get rid of it. So in the open market, doctors and hospitals once you break all those contracts, doctors and hospitals set their own consumer-friendly fees, meaning instead of having 7,000 procedure codes, you have maybe a few hundred. And you change it to charging by the hour as opposed to charging by the procedure. Once doctors start charging by the hour, cost of it gets a lot simpler. So you're paying a doctor for their time, and if a typical appointment's 20 minutes or 30 minutes, that's what they get reimbursed for. So that's the difference, and it's much simpler. And then now you can use that PSAS system that I was describing and easily put those costs right there on that system and compare them between all the doctors. All medical bills need to be settled at the time of appointment. So remember I said that you need to figure out what the cost is going to be before you go to the appointment. Once you go to the appointment, right now you pay a copay and the insurance covers an unknown amount and you don't find out about it until weeks later. In the open market, you use an insurance issued what I call a medical care credit card, which is a American Express, MasterCard, Visa, or Discover, and you pay the full amount to the provider at the time of appointment. Right now we have this game that goes on where if you're Medicare or Medicaid, the amount you're charged is actually less than what the hospital's cost is. So they shift that loss over to we who are privately insured. So our rates go up $3 for every $1 of loss. That's why our rates keep going up, because the government's paying less and less, and they put more regulations in that help them pay less and less, and we get the brunt end of that. No more. In this system, you pay the doctor 100% of their fee at the time of your appointment. Now, you can say, look, I'll, send me the bill, I'll pay in 30 days. But the point is that it's settled at the time of appointment. And insurance, then the insurance will debit the covered amount on that credit card, and you pay the balance at the end of the month to the credit card company. It's a much simpler system. I've read a lot of articles about how do we become in healthcare much more like the retail industry. It's with credit cards. You do it this way. It's an unlimited credit card. It's low interest. I put in the book it should be capped at 6%. I think we need to overtly say that, and get rid of all the crazy fees and penalties. And then you could transfer any of those amounts to another loan company for a lower amount of money. So what federal legislation are we going to need? And this is my last slide. The Private Healthcare Financial Act. So I've got actually 7 bills that I took the plan I put together and I matched it up with the kind of bills that we need to put through Congress, and I put the outlines of those bills in English in the book. Private Healthcare Financial Act sets up the medical escrow account. Private Health Insurance Consumer Act actually helps to set up some of these, the credit card and a number of other things. Medical Care Act talks about how to use the PSAS system and electronic medical records, as I've mentioned. And here's the Portability Act, which adds to that. And then the Fixing Medicare through the Medicare Private Act, Federal Medicaid Private Act, and the Private Healthcare Job Retraining Act. So when you go ahead and pull out 2/3 of the money out of an industry, you're pulling out essentially 2/3 of the cost and likely 2/3 of the workers in that industry. There are many, many people that are not necessary in the healthcare business. There's so much bloat, it's crazy. So we've got to find jobs for them. And I think we need a specific bill that helps them make that transition into manufacturing, into other services, what have you. And I think we need to do that to help them make that transition. And that's my book, and that's my plan. And I'm really interested to hear what questions you have. I've got some professional services I'm putting together for companies looking to figure out how to deal with all these government changes coming. And hopefully you'll buy my book, and I'd be glad to sign. I've got some cards there. I can, since it's electronic, I could go ahead and sign those cards for you and give you a signature if you like, and before you leave here today. So yeah, Nikki. So thank you.